Hi, everybody. Welcome to today's Student-Led Journal Club meeting. Today we have a NERVE presenter. If you don't know what NERVE is, it's a national group that we partner with at the MKRC that focuses on neuro specialty. So student doctors that are interested in any kind of neuro-focused field. Today, student Dr. Nikki Barrington is going to be talking to us today about an article of interest that she found. So to introduce our speaker, student Dr. Nikki Barrington is an MD PhD student at Rosalind Franklin University of Medicine and Science. She received her bachelor's from the University of California, Santa Barbara, and her MPH from the University of California, Davis. She's currently completing her PhD in neuroscience, studying neuroinflammation in the context of traumatic brain injury, and plans to specialize in neurosurgery. Her research interests beyond traumatic brain injury include spinal cord injury, neuro-oncology, and neurosurgical education and training. As a medical student, Nikki served as the president of the Rosalind Franklin Student Interest Group in Neurosurgery. She's been a member of the MSNTC's NERVE group during the 2021-2022 academic year and will serve as the junior director and journal club coordinator for the NERVE club during this upcoming year. So with that, I will hand the floor over to you, student Dr. Barrington.
Thank you so much. Hi, everyone. As Anne-Marie said, my name is Nikki Barrington, and I am an MD PhD student at Rosalind Franklin University. And today I'd like to talk to you about the current state of women in neurosurgery. Well, our focus today will be on a paper published earlier this year by Dr. Sharona Ben-Haim and her team at UC San Diego. I have brought in components of similar papers, such as this one written by Dr. Aviva Abash at the University of Colorado in 2018. The barriers for women may neither be obvious nor even acknowledged, but they exist. I find this quote incredibly poignant, as we often like to believe we live in a post-sexist and post-racist society, but the events that have unfolded in recent weeks and throughout the last several years have truly painted a vivid picture of how much work remains to be done to address representation of marginalized groups in medicine and elsewhere. As I mentioned, today we'll be discussing a paper entitled Gender Equality in Neurosurgery and Strategic Goals Toward a More Balanced Workforce. Aside from the reasons I already mentioned, this topic is near and dear to me because I have first personally faced many of the obstacles described in this paper during my medical education, and I know I will continue to face these obstacles as I progress into neurosurgery and my family priorities change. Because of this, I hope to stand on the shoulders of giants, specifically the women leaders in neurosurgery that have come before me, to make changes that will address these obstacles for me, my peers, and women that want to pursue neurosurgery in the future. Before we jump into this paper, it is important to note that a similar paper was published by Dr. Deborah Benzel and colleagues in 2018. That paper established a goal for 20% of neurosurgical residents to be women by 2012 and 20% of practicing neurosurgeons to be women by 2020. Though we have made progress in terms of including women in neurosurgical leadership, specifically having a woman president of the Association of Neurological Surgeons and the Society of Neurological Surgeons, as well as women appointed to neurosurgery department chair positions, we did fall short of meeting those goals. Which you can see here in this graphic from the paper, marking neurosurgical women graduates by the decade starting in the 1970s until the 2010s. So we can see that clear progress has been made here, as in the 1970s, there was only 4 women neurosurgical graduates, and now in the 2010s, there have been 317. However, like I said, we did fall short of meeting that 20% goal. You can see this quantified a bit more in Dr. Abash's paper from 2018. So from 1980 to 2004, we had a 7.3% increase in women neurosurgical trainees in a 24-year period. And then in half as much time from 2008, when that paper was written, to 2020, we had a 8% increase in women neurosurgical trainees. So we have had consistent progress. And this delineates the women neurosurgical graduates specifically by each year from 2010 and projects all the way out to 2030. So we can see from this that we are projected to potentially meet 30% women neurosurgical graduates by that year. So this is still far from parity, but how can we ensure that this increase to 30% comes to fruition by 2030? And before we get to that, we need to better understand the reasons for slow progress. First off, trickle-down academics is kind of how we thought this would come to fruition if we had more women making up matriculating medical student classes, then eventually there would be more women practicing neurosurgeons. But trickle-down academics is really not enough to bring gender equality to neurosurgery when there are systemic barriers in place slowing women's advancement in this field. We can see very clearly in this graphic that even though women now make up 51% of matriculating medical students, less than 20% of applicants to neurosurgery are women, and even fewer actually become board certified neurosurgeons. From about 1990 to 2010, there was about 5% female board certified neurosurgeons, but the following decade saw a lot of improvement, and as of 2019, this number had rose to 12%. But divided by academic rank, women make up 15.4% of assistant professors, 13.3% of associate professors, and only 5.8% of full professors. So we're not really seeing this increase in women in medical school necessarily translating as well as we had hoped to women in neurosurgery. So there's a lot of reasons for this, and some of them are listed on the left-hand side here. Unconscious bias toward women, harassment in a field that's largely still dominated by men, increased home and family responsibilities, lack of mentorship opportunities, and lack of pay parity represent significant barriers to entry, as well as significant reasons for exiting the field. To explore the lack of women applicants in neurosurgery a little bit further, we'll go into some data on the neurosurgery match process. So this first graph and the following one are from a 2018 paper on the neurosurgery match that shows the percentage of matched and unmatched female applicants for a given cycle from 1990 to 2007. So when we compare this graph to this following graph, we can see very clearly that there are a lot more male applicants overall, but also that those male applicants tend to be more successful in matching. And more specifically, during the period studied here, male applicants had a higher likelihood of successfully matching, with a 73% successful match rate compared to 62% of women, even when factors such as the USMLE Step 1 score, medical school ranking, and Alpha Omega Alpha status were controlled. For those that may not know, Alpha Omega Alpha is an honor society that is specifically indicated on your residency application. So all of this data kind of speaks to both unconscious bias and potentially a lack of mentoring opportunities that women applicants face when they're applying for neurosurgery. This quantifies it a little bit more. So you can see here that the odds ratio for successful match outcome were significantly lower for women than for men. And like I said, that is even when they controlled for those other factors that are predictors of a successful match, which we see on the next slide here, that USMLE Step 1 score and medical school rank are very strong predictors of matching. But even for women, that's sometimes not enough. However, the USMLE Step 1 exam is now pass-fail, so it'll be really interesting to see in the coming years if there is a greater emphasis placed on Step 2 scores and research experiences when applying for residency, and whether this will either help or hinder more women from matching into the field. So to summarize, while Step 1 score and the applicant's medical school ranking are the greatest predictors of a successful neurosurgery match, women remain less likely to match even when you control for these factors. And in addition to these challenges with matching into the field, a survey study of female medical students reported that 88.5% felt that there was a glass ceiling for women in medicine. And a significant proportion reported that they felt they would face inequality and adversity in applying for residency. So from this, we can see that even the perception of inequality is sometimes enough to deter women from a male-dominated field. Despite those challenges, many women have been successful in becoming neurosurgeons and have really shattered a lot of glass ceilings along the way. And I'd like to take a minute to talk about some of those women. On the left here, we have Dr. Shelley Timmons, who is the first female president of the AANS and is also now a chair of the Department of Neurosurgery at Indiana University. In the middle, Dr. Deborah Benzel is one of the founding members of the Women in Neurosurgery organization and was a strong advocate for getting it included as a subsection in the AANS. And from what I read, as in 1989, a group of 8 women met at a national neurosurgery meeting and realized that that was the first time that they had seen other women at a national meeting. And it was the conversations during that meeting that led to the creation of the Women in Neurosurgery organization. And lastly, on the right, we have Dr. Corinne Marasco, who was chosen to be the head of neurosurgery at the University of Michigan in 2005, making her the first female chair of neurosurgery in the United States. In general, regarding leadership positions, that much like with our residency applications, there has been some improvement. The percentage of women in board positions in organized neurosurgical societies has increased or almost doubled over the past 5 years to 28% between the AANS, CNS, SNS, ABNS, and the Council of State Neurosurgical Societies. But there continues to be a gap because we have only had one female president of the AANS and the SNS. And furthermore, among academic neurosurgical programs, women held, as of 2018, only 62 clinical directorship positions, so 7 program directors and 5 associate program directors. And at the time, there had only been one chair of a neurosurgical department, that was Dr. Marasco. So there's still a lot of work to be done in terms of bringing women into these leadership positions, both in their individual academic departments and in national neurosurgical organizations. So as I mentioned, research is an important component of becoming a neurosurgeon and being a neurosurgeon. As we know from being part of this NERVE group, research is often, or academic productivity is often a factor in deciding whether you will progress from assistant to associate to full professor and what have you. And it's also important when you're applying for neurosurgery. So what do we know about research among women neurosurgeons? The percentage of female authorship has increased from 12% to 16.5% for first authorship between 2003 and 2018. However, there was no concurrent increase in senior authorship, so women may still be facing a degree of publication and grant bias when performing research. It could be that they don't have enough mentors when it comes to research, or that when they go to publish their results or they go to seek grants to support their research, they're less likely to get them. Interestingly, this study also found that women were more likely to be published as a first author when there was a female senior author rather than a male senior author. So that also highlights the importance of mentorship in research, as well as just in neurosurgery in general, to have those allies, which can also be men in the field, to really advocate for bringing women to the forefront when it comes to research, leadership positions, invited talks, etc. And the last component of this table looks at specifically Neurosurgery and Journal of Neurosurgery, so the 2 biggest journals in the field. The current gender makeup of the editorial boards of these 2 journals is 15.3% female. And other studies looking at scholarly activity among female neurosurgeons have found that a higher proportion of women complete fellowships than men, but they still have significantly lower H indices with men, even when total publication years are accounted for. And I know that from my own experience with collecting data on this, a lot of databases like Google Scholar, Scopus, what have you, that publish H indices, or they calculate and publish H indices for authors, often don't capture all of the publications for a given author. And this likely disproportionately impacts women who may change their name after marriage and may therefore publish under multiple names. So unless they go into the system and claim their papers as their own, this may artificially decrease their number of publications and their H index. And I think this may explain some of the discrepancy that we're seeing here, but very unlikely to me that it explains all of it. So in addition to both the successes and the obstacles that I've discussed so far with regard to women both applying to neurosurgery and moving through the academic pipeline in neurosurgery, women face a variety of other challenges that are prevalent across the medical field, not just in neurosurgery, but they may be particularly problematic in neurosurgery. First off, taking leave for pregnancy, birth, and childcare of a newborn can be incredibly difficult during training, whether you're a neurosurgeon or really any other field. A survey study of women in medicine found that among those that plan to have children, 92% anticipated insufficient time to care for newborns, and 77% anticipated discrimination by coworkers related to pregnancy and childcare. In addition to this, female surgeons of any subspecialty are more likely to have major pregnancy complications than non-surgeons. And for those that operate more than 12 hours a week during the 3rd trimester, the risk is even greater. And furthermore, miscarriages are twice as common in female surgeons relative to the general population. So we can see that there's a lot of things that female surgeons and neurosurgeons in particular may be facing as they progress through their training and the field that not only impact their family, but also impacts their mental health. And as we know, there is also a huge stigma in medicine around seeking mental health care for healthcare workers in particular. And so I think that's something that also needs to be addressed in order to reach gender equality in neurosurgery. So in addition to the family planning issues, sexual harassment is a hugely pervasive issue in medicine and in neurosurgery as well. Of 622 neurosurgeons surveyed in one study, 55% had personally experienced sexual harassment, and over 62% had witnessed harassment in some form. And men in superior positions were identified as the offenders in 86% of allegations. So if that wasn't enough, female physicians and neurosurgeons across specialties, whether it's medical or surgical, are consistently paid about $20,000 less than their male counterparts, which comes out to about 90 cents on the dollar. And those differences are even greater for specialists like neurosurgeons. And lastly, in addition to that, women face greater rates of attrition during training. 16.7% of female residents left their programs compared to 5.3% of men. And with regard to board certification, this study was a little bit older, but back in the 1990s, only 63% of female residents became board certified compared to 81% of men. So all of that being said, what can we do about this? First off, mentorship. This paper discusses several recommendations, one of which is mentorship, which I think is absolutely essential. We need, in order to recruit and retain women to neurosurgery, we need mentors that will foster their career goals. We need more positive female role models for aspiring neurosurgeons, whether they're men or women. And we need to create greater opportunities for mentorship, particularly with individual departments can sort of formalize early mentorship opportunities for medical students, residents, and junior faculty, because I think it's important to remember that it's not just the medical students applying for residency that need mentorship, but the residents need mentorship and the early faculty need mentorship. And society leadership, as in organized neurosurgery, and journal editorial staff should also help to promote women on their editorial boards and in the leadership of their organizations as well. And the more women we have in those roles, the more they can mentor other women to eventually go into those roles as well. Secondly, parental leave policies. I think we all know that this is an issue throughout the US. It's not just affecting medicine, but neurosurgical departments in particular need to specify and promote family leave policies for all neurosurgeons. And I don't just mean women, because I very much think that men deserve and should take parental leave as well. But also to discourage discrimination from peers or administration around people that are taking family leave and normalize discussions around the topic. I also think that it can really be a challenge for women who are breastfeeding to do that when they return to work. So offering spaces for that to happen is really key, and offering greater flexibility around scheduling elective rotations that are maybe a little bit less clinically demanding to work with the residents and early career neurosurgeons' schedules so they can grow their families is really key as well. Thirdly, compensation equity, again, something that we know is a problem throughout this country, but particularly with regard to neurosurgery, we need transparent compensation mechanisms and clear policies to ensure that there is equal pay for equal work. We need to be analyzing our own data and holding ourselves accountable internally, as well as publishing compensation reports publicly so that they can be reviewed at an institutional and national level. And also, much like the conversation around family planning and family leave, discussions around compensation have to be normalized, and the administrators and other folks making decisions about compensation should be educated about unconscious bias and how that might impact the pay that they're willing to give to a woman versus a man, et cetera. And lastly, harassment. So as discussed, neurosurgery in particular is male dominated, and that not just because it's male dominated, but just like many fields in medicine, this has bred a culture of harassment, and departments really need to take steps to cultivate awareness, and not just harassment in the sense that we all traditionally think of it, but also in terms of unconscious biases and microaggressions. It's not always about the more obvious types of harassment. And promote zero tolerance policies for this type of harassment and safe reporting structures for those that are victims in order to not have fear of retaliation. And speaking from personal experience, I personally feel that those that report should not only be taken seriously, but that such reports should result in re-education for offenders. That I think that this needs to be kind of a work in progress, and that people that are part of the problem need to be re-educated rather than just slapped on the wrist. Okay, lastly, some further recommendations from Dr. Abash's 2018 paper outlined a few more specific things that we can do for tackling this issue. Like on-site childcare that has extended hours, prioritizing women being invited for keynote talks and lectureships, and systematically tracking the stats on women in neurosurgery so that the onus isn't so much on the women surgeons to do the research on this themselves, but the stats are continuously tracked by the large national organizations that really should be responsible for spearheading some of these efforts. And lastly, the paper we're discussing today, Dr. Benheim's 2022 paper, concludes with an update on those recruitment goals that were published in the 2008 white paper on neurosurgery. And the goals specify now that 30% of all neurosurgical trainees should be women by 2030, and 30% of practicing neurosurgeons should be women by 2038. And though we clearly have several outstanding women leaders in neurosurgery that have paved the way for change, it's really going to require advocacy and policy development from our national neurosurgical organizations and individual institutions, and the allyship of our male colleagues in order to reach true parity in neurosurgery. And in conclusion, I'd really just like to note that true parity doesn't just mean the inclusion of women. It means the inclusion of all marginalized communities, including Black and Indigenous people of color, Latinx individuals, and LGBTQ folks. And neurosurgery should really seek to reflect the diversity of our patients in our workforce. And the lessons that we learn here from women in neurosurgery can be applied to bring those much needed changes to the field. And with that, I will take any questions.
Awesome. Thank you so much, student Dr. Barrington, for coming and talking to us about this today. I really appreciate your presentation. I think it was really insightful for the field of neuro and just in general. So again, I think some of you are already starting to do it. Please raise your hand if you have a question. Feel free to type in the chat if you can't unmute. Dr. Gordon, I think I saw your hand up first.
Thank you. I didn't raise my virtual hand.
Okay, I saw your real hand.
I just wanted to thank you very much. It was an outstanding presentation. I wanted to kind of go back to a more root cause, or like a little further deeper back. And that is, in order to go into the surgical subspecialties, you first have to do general surgery, right? So what I thought would be interesting is to actually look at the same stats for general surgery, because if you don't have the pipeline through general surgery, you're not going to have it into the other surgical subspecialties. And then secondly, compare, this might be, future research or something you might want to look at, looking at comparability between other surgical specialties as well in comparison to neurosurgery. I don't know if you've looked at any of those data or not, but that was kind of what occurred to me. I think the match data is extremely compelling and supports your thesis on this, but I think you also need to look back at how many women are going into general surgery, because that's the feeder.
Yeah, absolutely. I think I'm scrolling because I actually am about to submit a paper on this, and the general surgery percentages for other specialties are 35% in general surgery, 35 for ENT, 25 for urology, 25 for plastic surgery, and 21 for thoracic surgery. So I have a little bit of data on that, but I totally agree that we need to be looking at other surgical specialties and comparing and seeing how we can do better. Because I believe neurosurgery and orthopedic surgery are the two lowest as far as percentages of women. So I think that can also be super helpful in giving insight on
that would make sense, me not knowing the data, but since you're writing a paper, maybe you can include that more, emphasize that more in your introduction part.
Yeah, absolutely. Thank you.
Thank you.
Dr. Joy, I think you had your hand up next.
Yes, ma'am. I think that this is a very interesting talk. I like that you talked a little bit about attrition during residency, and you talked a little bit about harassment, which I have had the opportunity to witness, not just from the surgeons that are training, but from the nurses, nurse managers, that make or can make that environment very hostile. Things like, well, why don't you move the patient yourself? Or, those kind of comments or derisive attitudes are definitely, they definitely make the environment hostile. And the difficulty with that is that if you spent enough time in your residency and you decide, hey, this is not the place for me, I don't want to be in the surgical suite, I don't want to do that, you've already used up your funding to go toward. If you say, okay, well, I want to just do family medicine instead, you've already used up your funding. So you can't jump ship and go to a family medicine residency to get that support. So, or you won't be paid for your residency. So I think that that's a real catch-22, because you're not only eliminating those people from neurosurgery, but in a lot of cases, you may be eliminating them from medicine altogether, because they can't be residency trained and therefore can't, qualify for insurance company payment and the like. So thank you very much for this talk.
Yeah, thank you. I also think that we're seeing an increase a lot. I know from my own personal medical school curriculum, I know that this to be the case, but it's not necessarily at every medical school. There's a lot of emphasis on interprofessional education. And I think that is particularly key for issues just like you mentioned, where there's, especially now that we have, so many in the US allied health providers, we have PAs, we have NPs, we have so many different sort of levels of care, and we need to figure out how to all work together with the goal of better patient care rather than, fighting amongst ourselves. So I think interprofessional education is really key there as well.
Thank you.
Dr. Rosh, you have your hand up.
Thank you. I really enjoyed your presentation. Nikki, a while back, I had to give a presentation talking about the specialties in women going into medicine. And I just have two questions for you. I know how I felt when I was preparing the talk and doing the research. From a personal level, if you just could share with me how you felt while you were preparing the talk, were your eyes opened? Were you surprised?
As I mentioned, I have been working on a paper for a while on just like the current state of women in neurosurgery, looking at the 2019-2020 residency class and where are we at. So it wasn't entirely new to me, but just in general, learning this information it's incredibly frustrating. And as I briefly alluded to, in light of recent news from the Supreme Court, it's, adding on to that just frustration in general of, what's it going to take for us to be taken seriously? Because, I'm here to become a surgeon. Nothing is going to change my mind. And I just want to have the same support that my male colleagues have when I go do that.
Exactly. And I think you hit the nail on the head when you said about funding. It's often underfunded and under-recognized. And there are several publications now that, one journal will not publish a paper unless there's parity with funding, with equal distribution of opportunities, both male and female. It's really interesting how they've recognized it and the discrepancy. The other interesting thing is once you get out in practice too, the battle sort of doesn't stop, because from my understanding, the female surgeons typically will take the less bread and butter type cases, and those will be deferred to their colleagues in other separate situations. So there's a lot of barriers that need to be broken down. So I'm so excited for you and support. Hopefully you'll find the love and support and from your mentorship from the university, and as you go forward throughout your residency and your training, and you'll circle back and help, right? It gets a little better, the opportunities for everyone as we go along. Thank you.
Yeah, we lift as we climb.
Right.
So there's also been, in putting together this presentation, I saw a paper that was talking a little bit about what you were just saying about women physicians in general tend to earn less, as in reimbursement from insurance companies, tend to earn less because they see less patients because they spend more time with their patients. And I think there was also a paper a few years ago that found that female physicians generally have better outcomes with their patients, likely because they spend more time with their patients. And so there's definitely some interesting findings there.
I love that you lift as you climb. I love that. I'm so glad you said that. Dr. Johnston, you have your hand raised.
Thank you. I too wanted to compliment you on your presentation, and it's you definitely have a lot of passion for this area.
Thank you.
And it's a palpable message that we can feel how passionate you are in pursuit of your goal. I can speak from Kansas City University's perspective relevant to the entire medical school, particularly the osteopathic side of medicine, is here just in the last couple of years. We've had the matriculants that have signed up are about just the same percentage that you had mentioned, about 51% female. And I think that's been present for the last year and maybe two. So having said that, I can't tease out the marginalized side of it in terms of how many of those women are members of I don't know that for a fact. But I do know that I have a grand total of one lady physician that I know is a member of the American Academy of Neurology. And that is a very elite, tough group of tough association to get into. So therein lies, I think, some challenge even within your own domain of neurology, that it's a tough group to qualify and get acceptance into. So I would think that neurosurgery would be equally as challenging as the American Academy of Neurology. Are you familiar with that American Academy of Neurology and the degree of difficulty of getting membership into that group?
I've heard of the American Academy of Neurology. I'm not familiar with what's involved in getting in.
Okay.
But I can speak to, neurosurgery residency, especially being in this nerve group for the past year. I'm with several other medical students that either just matched or are starting the match process. For example, Taylor is on this call. That really can speak to how challenging it is to match into neurosurgery, particularly for anyone that has any kind of a marginalized identity, but also if you don't have a home neurosurgery program, if you are a DO, because there's still a lot of stigma around being a DO, which is unfortunate. And just so many communities that are not included when it comes to bringing more people into this field. And that's why I love what y'all have done with, bringing NERVE into this at KCU, because it's really important to give those people a voice and a pathway to neurosurgery where previously I don't think they really had one.
Well, I want to compliment again your passion and your depth of knowledge at this stage in your career. I have a feeling that we're probably going to be hearing a little bit more about you in the future. Nice job.
Thank you.
Student Dr. Caller, you have your hand raised.
Hi, Nikki. Great job. You
Hi,
did an amazing job. I mean, the data and everything, it's all pretty clear. You're obviously well versed on this as well. I really just wanted to, point out the great job that you did. And then I love that you touched on that a big part of all of what you talked about is just making these conversations known and just people being willing to have these conversations and making them not foreign. And because that's obviously the first step here for a lot of this. So I just really wanted to emphasize that and hit that home, but great job and proud of you. Good job.
Thank you so much.
Dr. Hillard.
I just wanted to say briefly, sorry I missed your presentation. I had other obligations, but I looked at the article and I think this is such an important time relevant article. And I'm so glad you presented this. I saw this out in practice. I mean, there was definitely a bias in some groups, and especially surgical groups. They treated the women partners as lesser. And I think standing up against that is very important. And I think KCU supports that solidarity. And thank you for presenting this article. Again, I'm sorry I missed your presentation, but I think just bringing up this article is so important for Kansas City, but also for physicians and practicing physicians in the surgical specialties. So I'm kind of echoing Dr. Jay's speech, but I think it's just so time relevant. So
Yeah, thank you. I think I alluded to this at one point, but I think more than many other things, having our male colleagues be our ally in this is really how we solve the problem. So
absolutely, yeah, I agree completely. So.
Any other questions? Comments? If not, thank you so much again to Dr. Barrington. So I hope you guys will be able to join us again next week. Again, thank you so much to Dr. Barrington. That was great. Thanks everybody for being here in the audience. Have a good weekend.
thank you so much.